Okay, so let's begin, shall we? Let's start, I guess, with introductions as normal. So my name is Anna Richard, and I am the Director of Children's Services here at the Champion for Children Foundation. And we're meeting today to continue our discussions for our task force for Highlands County, our Hope for Highlands, building a trauma-informed community. So today, please introduce yourselves. We have a couple new members, and also answer a question if you like to try new things or not. And that could be like, if you go to the same restaurant, you always order the same food, or do you like to try new things? Maybe go to a new restaurant, or, you know, new hobby, or anything like that. Yes or no, do you like to try new things? And I will go last with that, but let's start with my team. We have Carissa, Katie, and CJ. Please introduce yourselves and answer a question if you like to try new things or not.
Hello, my name is CJ Wingate. I am Anna's assistant because I can't think of my title right now, top of my head. And when I go into a restaurant, I will order the same thing over and over and over again. And I try to get out of that rut, but it's hard.
Her title is Family Resource Specialist. Okay, Katie.
Family Resource Specialist. Thank you.
I'm Katie Pippin, and I'm the executive assistant and graphic designer. And I will try new things if they are thoroughly researched. And I get lots of positive opinions about it. I like to go new places and experience new things, but I am a little wary with my food, I guess. Somebody has to say this is really amazing for me to trust it and go with it.
Yeah. My name is Carissa Marie. I'm the CEO of the Champion for Children Foundation, and I like probably a mixture. If it's a day where I need some comfort food, then have to have the same, but I need a mixture of some adventure in there. So trying new things, whether it's food or experiences, I like to try new things.
Awesome, thank you. All right, let's go with Varuch.
Hi, I'm Varuch Simmons, a community engagement specialist at Heartland for Children. And yeah, I do like to try new things.
All right, thank you. Sally?
Hi, everybody. Good morning. My name is Sally Fernsel, and I am the supervisor at Healthy Families in Highlands. And I love what I do. I love our mission, and I do like to try new things. I am here, after all. I like new ideas. I like to be part of something that seems like for the greater good. And the newest thing that I have tried is paddle boarding. And you know, so I'm pretty open to new things, although I do also get comfortable with like the same old shows. Like I have a hard time getting away from Mom or Last Man Standing. Thank you.
Great answers. Yes, thank you. Marissa.
Hi guys, I am Marissa Stam. I'm the Executive Director of Salamta Family Project and the current chair for the Children's Services Council. I love to try new things. I love to go new places, eat new food. Yeah, I'm all about it.
Nice. All right. Darlene.
Hi, everyone. My name is Darlene Dick. I'm a school social worker, and I will be your representative for the school board. And no, I do not like to try new things. I'm a creature of habit, unless you talk me into it for a really long time.
That's good to know. Thank you, Darlene, for joining us today. So important that the school board is involved in this. All right, we have Ramona.
Good morning, everybody. I'm trying to do a little bit of work here while I'm listening in, so that's why I'm blacked out. I don't want y'all seeing me look all over the place.
Absolutely.
I am Ramona Washington. I am Ramona Washington, executive editor of the Highlands News Sun. And as far as trying things different, oh yes, all the time. I don't like to eat at chain restaurants. I like to go to the little moms. So that's my favorite thing to do. So thank you.
Awesome. Thank you. We have Kim.
Here we go. Hi, I'm Kim Fairby with Choices Family Resource Centers. I'm the executive director here. And I do like trying new things as long as it's not something crazy. I'm not going to go skydiving or anything. But I like trying new restaurants, but I will be a creature of habit and find one thing I like there and probably stick with it every time I go. But do like exploring new restaurants and new activities. We took up gardening during COVID, and so that's been a new adventure for us and enjoying that.
Awesome. Well, welcome to the group, Kim. I'm glad you're able to join us.
Thank you. I've been watching, getting caught up on the videos, so y'all are just doing an awesome job.
Thank you. Yeah. Thank you. We have Ellie with us.
Sorry, did you say my name? You glitched as soon as you said
yes, Ellie.
name. Okay. My name's Ellie Choate. I work with Peace River Center. I'm a T-Boss therapist. I'm sitting in for Tiffany Fritchie, who's our director. But I would say that I love new things. However, I am a creature of routine. So when I'm home, love the routine, love my mornings. When I'm out and about, I will try pretty much anything. It's very fun.
Very cool. Well, thank you for joining us as well. We have Kadian.
Good morning. My name is Kadian Parchment with Heartland for Children. I'm the resiliency coordinator, and I'm happy to be with you guys this morning. And yes, I like to try new things, go to new places, try new food, experience new music, adventures. I'm all for it.
Very nice. Thank you. And then we have Denise.
Good afternoon, or good morning. Sorry, I just got the email a few minutes ago, so I'm kind of jumping in. So I kind of take it we're supposed to say things we like to do, or?
Yes, introduce yourself, who you are, where you work, and if you like to try new things or not.
Oh, okay. My name is Denise Williams. I'm with Highlands County Veteran Services. We here in our office assist the veterans by helping them navigate through the Department of Veterans Affairs. We're an advocate for them and what benefits are available to them, their children, and their surviving spouses. Do y'all like to try new things? Yes, ma'am, I do.
Awesome. That's great. Well, thank you for joining our group today as well. I know Sarah Beth sent me your name and email to get you involved, so I'm glad you're able to join us.
Thank you. I'm excited about being on board. Thank you.
Great. And then we have Ingra.
Good morning. My name is Ingra Gardner. I am the Director of Community Programs with Highlands County Board of County Commissioners. And I do not like to try new things. I struggle. The struggle is real.
Yes.
So no, I'm an old, just let me do what I've been doing for years and it works.
There you go. All right. Well, thank you all for sharing. My situation is kind of like Ingra. I'm very stuck in my own ways, but I am trying. I'm definitely trying to explore new things and do things I've not done before. And it's definitely a new adventure and chapter in my life. So it's good. Change can be good. The quote I put on for today is, "Nothing important was ever achieved without someone taking a chance." Sometimes when we get out of our comfort zone and our little box. Taking a chance, trying a new thing might be a good thing. So, but you don't know until you try, right? All right. So let's really quickly summarize our last meeting. We had 16 attendees last time. And yes, you all know we have about 26 to 30 very active members in our group, but not everyone can join every time. So we do see different faces every time, which is great. We have 15, I would say, that are not very active, but they're still participating behind the scenes and kind of follow up on the videos or so forth. Recapping last minute. We did talk about, we have the Hope for Highlands YouTube channel, so you can access our meeting videos. They're all recorded. We are working on creating our strategic plan. The way we're doing that is just kind of throwing out some questions and having discussions and ideas that pop up. Please don't be afraid to share any ideas. We will consider everything and see if we can work them in. Sarah Beth spoke about the Darkness to Light training that they do, which is, I'm just going to read it, which empowers adults to prevent, recognize, and react responsibly to child sexual abuse through awareness, education, and stigma reduction. And I know that Sarah Beth and Mercedes have put quite the goal of training a total of 4,284 community members in this training. So please sign up. This is a training that will benefit each and everyone that are attending here or not attending, so everyone. And that's all I'm going to say on what we did last time, because what I'm going to do is pull up the, let's see if I can share my screen with you all. The strategic plan that we're working on, and what I will do is kind of go through it, what we talked about a little bit last time. So for you that are new, I have broken down how to build a trauma-informed community by A, B, and C. And we worked on the A last time. So the A is saying a trauma-informed community establishes a holistic strategic plan that links a community together for the purpose of surrounding, supporting, and protecting community members from traumatic events, re-traumatization, and its adverse effects. So the first question that I broke this down into was, how do we surround our community members and prevent traumatic events from happening in the first place? And then discussion was held from there. So we did talk about get involved with, pastors and church members, community leaders. A lot of churches have focus groups. They do a grief share. And maybe we could just get one person from each church that maybe holds these groups, educated in trauma-informed care, and kind of spread it from there. We talked about meeting people where they're at, and are there any preconceived opinions related to trauma and what trauma means and how it affects people? What are the myths out there? Do we need to maybe do a myth and reality kind of thing to get through those barriers? We need to engage on different levels. Start early, daycares. Then go to schools, community centers, neighborhoods, organizations, businesses, and churches. I mean, the sky is the limit here. We also need to engage individuals who has community social connections. We are working with a community where some of our parts are closed, and to get into a community that truly needs probably information would be to maybe talk to that one person who is connected with everyone in that little community. We talked about creating handouts for different community groups. Maybe we'll have a different handout for parents, for children, for families, for businesses, organizations, so that we focus our trauma message for different groups. And then we talked about normalizing trauma and what that means. We also talked about creating a series like the TED Talks, but call them like Hope for Highlands Talks, maybe, with different sessions discussing or presenting different trauma topics. And then to host these in different places to engage different audiences. We also know, of course, need to offer resources on how, where to get help for trauma. Create trauma-informed social connections for people, do it face-to-face, groups to network. You know, these are all things that just kind of pops out in our ideas. Create a library of trauma books for kids. So we have some TBRI books, and there's some other good resources. This is something we can definitely work on, to have kind of a little trauma library of books and involve the libraries with this as well. And then we also talked about having a list of community trainings, which I also attached in the email to this meeting today. There is 10 trainings so far that I've listed on that. There is the one that I do, which is the Intro to Highlands Trauma Presentation and Information Sharing. There's a Darkness to Light that Sarah Beth and Mercedes does. There is the Resilience documentary and the Paper Tigers documentary that Heartland for Children do. And then there is, of course, the Resilience documentary and the Intro to Trust-Based Relational Intervention. The TBRI, the Making Sense of Your Worth, Parenting for Positive Self-Worth that Marisa does. There is Mental Health First Aid USA that Advent Health does. And then there is the Compassion Fatigue that Bernadette does. So my question to that list, if you all have printed it out or can see it, is there a training maybe that we're missing? Is there any training that you all do that could definitely be implemented in our list of trauma trainings? Or I should say Hope for Highlands endorsed community training, so to speak. If so, you can let me know now or later. That's fine too. We did talk about the Hope for Highlands kickoff event, and we have scheduled that for August 25th, 9 to 12. It is a Wednesday. This will be in combination with the Highlands County Provider Symposium. Thank you, Sally, for holding out the flyer. Man, I really wish my thing. I'm gonna try one more time. Ha! Look at that. All right, so save this date, you all. August 25th. It is going to be a Hope for Highlands kickoff event, but it's also in combination with the Highlands County Provider Symposium that we did about 3 years ago that we really should have at least every other year, I think. But due to COVID, we did not have it last year. This is where you will be able to have vendor tables to share your information from whatever organization you're part of. So probably what we'll do is in the morning, we can all mingle and take part of each other's information, talk to each other, and then we'll have speakers. The speakers will be myself, Sarah Beth, Baruch, Marissa, and Bernadette. And I have room for one more. So if you have ideas or want to volunteer, you're more than welcome to. Let me know. It will be held down at the Circle Theater. And of course, it's a free event. And we are going to be sending out another flyer when we have all the details, but this is definitely the save the date flyer for this event. Any questions on that? Okay. All right. We also talked about the importance of focusing on the health and healing benefits of trauma, and inform people how it all connects. And I know Marissa have talked to us in the past about how primary health service providers are kind of making a little task force group that, you know, will be focusing on this, as well as probably other things as well, but using the ACEs, for example, when they screen patients. And then we talked about educating parents in regards to the impact of trauma to children, family. How can we reach new and current parents? Share with someone how trauma affects children. Probably parents. Domestic violence, child abuse, and neglect. You know, because a lot of adults and parents do not understand that what they do in the home, for example, can affect their children through trauma. We also talked about how parents and adults have trauma and how that affects them and their following generations. So how do we reach out to adults? That's the adult part of this. Get other agencies involved, law enforcement, DCF. We talked a little bit about family team conferences. That's a great tool for allowing families to speak up and get involved. We talked about making a list of prevention services and programs available in Highlands County. There's other task force that we should get involved in as well to kind of, instead of having gaps, just kind of combine efforts. Do a social media blast. We had talked about the random act of kindness in the past. Be part of other community events, set up tables, have handouts, share information. And then the second question that we started to talk about last time is, how do we build resilience in our community members? There is the 8 C's of resilience: competence, confidence, connection, character, contribution, coping, control, and consistency. It was mentioned that trauma topics might be difficult for people to talk about, which is kind of why we need to normalize it a little bit. We need to share a clear and honest message, be supportive to each other and our community members. Doing difficult things together can be helpful. So that's all that whole support and relationship building. Understand that sometimes there's a level of shame with experiencing trauma in your home, which is why things stay secret. People, families need to be aware that other families have these issues as well, and there's a healing process and that you're not alone. Some trauma is preventable, not everything, unfortunately, but child abuse, domestic violence, and such should be preventable. So we should have some sort of prevention message in our community to make it a public message. Engage counselors in school. And I know we had talked about, and for you that have not been part of us before, our logo, our starfish logo, is a great tool to have on your desk to show when people walk in the room that, oh, she knows trauma. She's trauma informed, so I can talk to her. And I want to share with you all. We did get them, so these will be handed out to you all. But you have to be trauma informed to get one. All right. We talked about how making a PSA, maybe having a school competition to make a fun PSA. We talked about there's 2 parts of this: awareness first. Step 2 is building resilience. I just added, well, some people are already aware, so maybe it's not a 2-part process for everyone. We talked about Highlands County lacking places for youth to go and for family activities to take place. So how can parents get involved with their children and activities? It was brought up that maybe we need to have a resilience community center and do some resilience projects, art, sports activities, life skill building. I know the Boys and Girls Club, YMCA and such already do a few of these things. And Marisa brought up that one of the obstacles is that our community sometimes forget there are families here all year around. And I think that's all that we talked about, which is a lot. So let's go back because, wow, time is just flying by, you guys. I would like to keep our discussions going and keep working on our strategic plan. Plus, I need a break from talking so much. So this is when the group needs to come back and speak up. I believe where we stopped last time, I don't know if we're done with this question yet. How do we build resilience in our community members? Or if you rather go to the next one, which is what services do we have that are already trauma informed and what services are providing trauma informed care? Because of what I would like to do is kind of say, hey, if we already have community programs, organizations that are trauma informed and that provide trauma informed care, how does that look like? And how can we kind of follow in those steps if they do good things? So do you guys want to start with that question today and see where that leads us?
I did have one question that is somewhat unrelated, somewhat related.
Okay.
Have we ever heard from, I know as being part of the statewide calls that Manatee County, they like really were, I think, the first in the state to like really look at the whole trauma-informed community thing. And it may be good to reach out to them and look at, you know, like what they have done and some of the framework that they have set up to see what were those lessons learned. And it may be a good, you know, like just conversation at least. So I don't know if that was already done, but I just wanted to put that out there.
Yeah, that's great, Ruth. Thank you. I have not technically spoken or talked face-to-face to anyone there, but I have done a lot of research on different trauma-informed community building around our state and nation. And I know I said in the past that everyone seems to do it a little bit differently. Which is why we're making our own strategic plan and what works for us in our community. But with that said, I think it might be fun to maybe invite someone to share and talk with us about what they are doing and give us some more ideas and see what works and what maybe not works for them. So yes, I absolutely think that's a great idea. Going back to this question, Dale, I'm wondering, looking at your own programs for the ones who are in here, do you feel like where you work, do you feel like you guys are trauma informed? And if so, do you provide trauma informed care? What does that look like? Is it working? Are we missing something? Give us some feedback. What's going on at your organizations?
And I really do not want to reiterate everything that Melissa said in our meeting, but you know, the school board is very involved with the mental health first aid training. Our mental health counselors, you know, not only do the training, but they have some other certifications in that area, like we talked about ever since Marjorie Stoneman. And then several of us, including myself, have done the compassion fatigue, as well as two-part stage of a Florida State University certification in resiliency. So there's a lot going on at the school board for all staff, from janitors to teachers to principals, especially in regards to mental health first aid. So there's several different stages going on, as you know, Melissa discussed in our meeting the other day.
Yes, so Miss Darlene, myself, and Carissa met with Melissa Blackman And we did talk to kind of get shared information back and forth, what we're doing with Hope for Highlands and what they're doing as a school board with their teachers and such. So thank you, Darlene, for sharing that. And they are doing a few things for sure, which is wonderful. Thank you. Anyone else?
And I also just would want to mention that they also do the Handle with Care initiative with the sheriff office as well. So that's definitely a strength.
Yes, they do. Yes, they do. Handle with care.
Well, I know for Heartland for Children, we are very try to be very trauma informed, and we actually moved from being trauma informed to trauma integration. So that's like how we handle staffings, how we address children, how we speak to each other, even internally, how we look at how children respond to behavior. It's not what you're doing, is like what happened to you. Some of these behaviors that we explain to caregivers and foster parents are because there is a result of their trauma and not necessarily a result of them being kids who are defiant.
Yes, that's great, Katie, and thank you. So I have a question. I have a follow-up question for you. So,
Sure.
So with that said, because I know with cases, DCF cases, how much are we focusing on the parents in their mental health, in their trauma history? I know we're always focusing on the children and their well-being, safety and such, but how much are we really focusing on the biological parents?
Well, that's a great question, and that's actually one of the main components of building resiliency with parents, is looking at what their trauma is and how they are managing that trauma, because oftentimes it's the unresolved trauma that results in the abuse and neglect towards their children. And so that is something where we're like, hey, not, oh, you're using drugs, you need drug treatment, but beyond the surface, how did we get here? What unresolved trauma has this parent experienced? So from the department standpoint, they do their family functioning assessment, which is like a comprehensive interview with the family, people who know them, history, and not only looking at what they're doing right now, but their history in general. How was your childhood? How were you disciplined as a child? What adversities did you face in your growing up or in your daily living? And so they look at those things, and a lot of times it's built into the services that the parents have to complete in order to get back custody of their children, or even if it doesn't go judicial, just to say, hey, we are recommending that you do this with a non-judicial case manager or as a volunteer on your case plan. I'm sorry, I turned my camera off. And so that's something that is definitely addressed with the parents, and part of what we look at when we're talking about being trauma informed. Also, Heartland, I mean, part of my job is implementing the ACE, Adverse Childhood Experiences screenings in our partnership with Central Florida Healthcare. So at their community location. So that's going to be something that is not only given to children, but given to adults as well. Anybody who walks in as a patient at one of these 4 facilities over the next 4 years will be given a screening, and then referrals and treatment plans developed as a result of that. I've also been the youth mental health first aid trainer for Heartland for I think the last 6 years or so. So that's something that we've had in place. We have a trauma integration work group that's been in place for the last several years. And again, the language is just something that we have integrated in our daily work. So not teaching people just to look at what the behaviors are, but just really looking at how we got to where we are is something that Heartland has really put forward an effort to do. And that's with us putting up posters, sending out emails, and just doing different things, workshops and trainings around trauma, and bringing in different providers and different resources like TBRI into our community, QPI into our community, to look at how we could address not just what's going on with the family, not just children's behaviors, but how trauma has really affected the entire core family.
Right, perfect. So then the question is, how can we bring what you do into our organizations down here?
Well, I mean, Bruce could probably speak to this because he's been involved down there for a while, but I think this group is a part of it, right?
Yep.
And offering those trainings and those events where we are able to do information sharing. And again, pretty soon with the grant that I'm on, I will be down in Highlands County in about 2 years to implement this part of that grant at that location down there. So I think it's a collaboration and the information sharing and just really getting ahead of it and making sure that we're all working together and normalizing trauma and how it affects us on a daily basis. Everyone, not just people in our system of care, not just our youth, but adults and professionals, and just making it a part of our daily work and looking at it in many different ways. So I think the work is being started, and Bruce could probably speak a little bit more to it as well. But some of the trainings that we do at Heartland that's being offered down there, and some of the collaborations on the work groups and the task force, I think it's getting us together to get this word out there.
Yeah, and I think one other thing that Katie didn't mention is, like, with our community partnership school, it's really, in a sense, operationalizing that whole idea of meeting the various needs of families, like through a trauma sensitive approach. So I know we previously had a training. Katie, I don't know if you can remember. Did we ever have like a customer service delivery blend of trauma-informed care? I'm thinking that I remember us having one, and I think as far as this conversation, it may be beneficial if we have something where for those who may be wondering what some ways they can incorporate it, it may be beneficial if we look at doing something that all right, cool, we understand trauma, we understand resilience, but from a business perspective, what does that look like? What are some practices that people can take away and implement into, their actual jobs? So I don't know if that currently exists. I want to say I think it does. But
a couple years ago, I did a series on customer service in general, just like how we interact with our coworkers, how we interact with our providers, how we interact with our families and our children, and then in our system of care. So it may have touched a little bit on that. I know that was a result of another grant or something that we had a couple years ago, but it does touch on, even in our regular trainings for pre-service, looking at how we provide information to caregivers about what's going on with the child, how we keep the parents involved about what's going on with their children. Some of these things are mandated things, and it trickles down to that good customer service overall and engagement and making the parents feel like they're a part of what's going on, because we know that being a part of the system is trauma. And so how can we reduce the trauma? And that speaks to even the slightest thing as not making the child move to many places, or looking at what school they're in, or making sure that there's some normalcy things in place. And so all of that is a part of that trauma integration, and making sure that we're hitting on those things at different levels, because it may not seem like much to us, but for that kid to be able to participate in that field trip that everybody else is going to, may be something that could help with their mental well-being and make them feel like they're a part of the community, and help to reduce some of those ACEs that they may experience as they navigate through the system and through life.
Yes. Anyone else?
Anna?
Yes.
I would like to speak on behalf of Healthy Families, the program that I work for, and I do believe that we are a trauma-informed program whereby we are a voluntary program, and we identify those risks at the initial interview, and not calling them, so not labeling any of that, but our curriculum is research-based. And so our main our main objective is to encourage parent-child interaction, but surrounding that and through that, we are addressing risks and trauma with the curriculum, which is a great curriculum called Growing Great Families and Growing Great Kids. And again, it is research-based. And I'm excited to be, hopefully to be part of the kickoff with a table and information. And we do a lot of things, but definitely we are trauma informed, and we do talk about ACEs with our families. We have those direct conversations with families after the relationship has been developed, when we feel that it's a good time to talk. It takes time, you know, and so that's just some of what Healthy Families does.
That's great, Sally. Thank you for sharing that.
Welcome.
Anyone else?
Anna.
Yes.
Hey, it's Kim with Choices. We mainly deal with adults that are coming into us, but they're looking at wanting to be able to parent well. And we now offer what's called Parenting Without Shame. And it really delves into, you know, how they were parented and how that affects how they're parenting now. And honestly, the majority of the women and men that we service have trauma in their past. They grew up in homes that were either abusive physically or mentally, and that's just a cycle that we see. And our goal is to try to help them to be the best parents they can and to recognize that cycle and to be able to move on from that. We're probably not as trauma informed as we should be, and I'm looking forward to contacting people on these lists to get us the training that we need.
Absolutely. Thank you, Kim, for sharing that. And that's a good point too. The whole reason why we're doing this is that so we can also become better trauma informed and providing better services, trauma informed care to our clients, but also internally, just like Heartland for Children are doing. I think that's wonderful. Anyone else that want to add to that?
Anna, this is Ingra. As the Director of Community Programs for the county, I oversee Healthy Families, Children's Advocacy, Veteran Services, the libraries, as well as Human Services. One of the untapped programs that I'm now thinking about bringing the Vicki Brown, who is our lead librarian, our head librarian, is the libraries. You know, our libraries are truly the hub of the community.
Yeah.
So much goes on at those libraries that I'm certain that the community don't know. They just think that it is in fact a place of books. But again, so much more happens at those libraries. And all of our staff need to be trauma informed. So I'd like to get with you to determine the best way to start that process. Vicki Brown is not only the head of our 3 libraries here, she's the head of the Heartland Cooperative. So that's 7 libraries, 5 counties.
Okay.
Getting her involved in this would be, I believe, very beneficial.
Absolutely. So, and again, a great place to start would be for me to come out there and do a presentation. That would be a great way to start and get the ball rolling. So thank you for doing that. Anyone else? Okay. Let's go down then to the next one, because I kind of want to start that and see if we can finish A today. And by the way, you guys, when I say finish, I don't know if our work will ever technically be done in our community. We're going to be putting together this strategic plan, but I don't see it as an absolute, like, it's not going to be ever fully completed. There's always going to be things adding to it as we move along with our work in our community. Just keep that in mind. So it's not like if it's not on the list today, we're never going to do it. That's not how this works. All right, so our next question then is, how do we support already traumatized community members that may have adverse effects? And how do we empower them? One of the things I put down here is, of course, creating safe environments and establish safe relationships. So just keep that in mind if something comes to you as you answer this question.
I think a part of empowering them is, like we've been saying, normalizing the conversation around the trauma, and also starting from early. You know, are we having these conversations with our children in the schools about feelings and how they're not going to always be happy, but how to work through that and developing appropriate coping mechanisms? Because oftentimes there's an elephant in the room in some communities that doesn't want to be addressed. So even going culturally, looking at it from a cultural standpoint, and seeing how to best approach that community to make sure that they understand that this is something that is normal and everybody deals with it, but also empowering them and letting them know that resiliency is available and resiliency is possible after trauma, I think is very important. And I think with the messaging and making it a part of schools and the library and visuals and what they see and what they hear will help to, one, reduce the trauma, but also empower people to say, you know what, there's other people who are going through this, and if they can make it through, I could probably make it through too. And there's community resources available, and there's different ways that I could really get the help that I need. So I think that normalizing it, and I know that's like the buzzword for the last year or so, but I think it really is important for people to feel as if they're not alone, to help reduce that trauma and to also help with the empowerment piece of it.
Yeah. Anyone else?
Yeah, I do have a comment about that. I think to piggyback on what Kadian said, we need somebody or some buddies to be willing to speak out, to speak up in order to normalize that, you know, and that trauma does affect, it's cross, it doesn't just affect a certain group of individuals. It's not a necessarily economic thing. So
yes. Yeah, I know what you're saying. Absolutely. It can happen to anyone. It's everyone. Okay, so you guys, let's leave it like that this time, because time's up. And just keep in mind, that's what we're going to start next time. I'm not going to go through it as much as I did today next time, because we are working on it. I do send it out and so forth. Because I want as much time as possible for us to actually get some work done. So next time, let's jump right into it at this question number 4 and move from there. And again, I appreciate everyone joining us today. If you're new or old in this group, you're all so very important to our community. So thank you.
Thank you, Anna.
Thank you. Have a good day.
Thank you.
bye-bye, everybody.